The New York Health Act is public, free, universal health care that costs less for our state without making private companies rich.
Healthcare for all means it covers everyone and everything. So mental health care, dental health care, vision, sexual and reproductive health, which is in danger all across the country. And for union members like me, it means we can bargain for more when healthcare is off the bargaining table.
Our politicians already have the votes to pass NIHA, but we need ordinary, working-class citizens to come together and demand that they hold a vote, to demand that they do their jobs.
Be a part of the movement that wins healthcare for everybody, no exceptions.
I want to fight for healthcare because I think everybody should have affordable and safe access to healthcare, and I live in South Buffalo.
I live in Lockport, and I want to fight for universal healthcare because a hodgepodge of private insurance companies have wedged themselves between us and the healthcare we need by charging extortionate amounts of money and debt. We need a universal single-payer healthcare system that will work for all of us.
I want to fight for healthcare for all because it's absolutely ridiculous that the wealthiest country in the history of the world is the only one that has not figured out that it is a human right yet, and I live in Snyder.
I fight for healthcare for all because healthcare should not be tied to your employment status. It shouldn't be tied to whether or not you can afford it, and it should not be tied to your political affiliation. Everyone should have the opportunity to receive the care they need. I live in South Buffalo, New York.
I want to fight for healthcare for all because it's immoral to profit off of a basic human need, and I live in the Lower West Side.
I want to fight for healthcare for all because taking the profit motive out of healthcare would result in more people getting the care they need, and that's something that everyone should have the right to. And I live on the west side of Buffalo.
I want to fight for healthcare for all because I think at this point it's not enough to just say that you're in favor of it. It's time that the elected government of the wealthiest nation on earth sees and hears the people who represent the majority in favor of universal healthcare, and I live in Snyder.
I want to fight for healthcare for all because I believe healthcare is a basic human right, and I live in North Buffalo.
I want to fight for healthcare for all because children should have access to healthcare regardless of their parents' insurance coverage, and I live in Sloan.
I want to fight for healthcare for all because you can be retaliated against for forming a union, and the loss of your healthcare on top of the loss of your wages is the biggest form of discipline that they have on us, and the biggest slap in the face.
I'm a Sean Ryan constituent, and I am fighting for universal healthcare because I believe everyone deserves access to healthcare and to be free from medical debt.
I want to fight for healthcare for all because people don't deserve to go into medical debt for the care they need, and I live in Niagara.
I want to fight for universal health care because it is fundamental to human freedom, and I live in Gettysville, New York.
I want to fight for healthcare for all because so many of us work ourselves to the bone and still have to break the bank to cover basic care, if we're covered at all. I live in the Lower West Side, and we work on top of organize, and politicians need to do their jobs too.
I fight for universal health care because insurance companies should not be getting rich off the preventable deaths of working class people.